Frontier Nursing University offers graduate programs for nurses at various stages in their education and careers. Our specialty tracks include nurse-midwife, family nurse practitioner, women's healthcare nurse practitioner, and psychiatric-mental health nurse practitioner. Students begin their journey with Frontier Bound, an enriching 4-day orientation on our Kentucky campus. This tradition is one of the most treasured memories for students and alumni.
I came to Frontier Bound and this is where I needed to be. This is where I had to be from Frontier Bound. So it was just, I needed that friendship-centered type of schooling, that distance learning that felt like you were still at home, like everyone was still at home with you. That was important for me.
It brought me closer to a better understanding of my purpose for my career. Being able to be out here and hear about the history of why the school got started and why nurse midwifery got started here made me really more passionate and more committed to serving the true mission of nurse midwifery.
We first went to Frontier Bound, so I was able to actually meet some of my classmates, and you form those bonds, and then through actually all of your curriculum, you are working together, you are studying with them.
Students complete didactic coursework in their home community, supported by the wonderful friendships they made during Frontier Bound. The length of the distance education program depends on the specialty track and whether the student is attending full or part-time.
Even now, I have a couple of friends that I started the program with, that I went to Frontier Bound with, and I don't think that I could have done the program without them. I needed that encouragement. I needed someone else to understand the level of anxiety that I had, the level of stress that I had, and that was there to be like, it's okay, I'm here with you.
So when you come to Frontier as a bridge student, you're treated as a graduate student from the start. That is very important, and it helps cultivate and mold your mindset very quickly. And you realize that you are on a pathway to be an advanced practice nurse.
Once their didactic coursework is complete, students return to Kentucky for a skills-intensive experience called Clinical Bound. This is an exciting time on campus as students validate their skills with faculty, spend time with classmates, and prepare for their clinical experiences.
I feel like I'm learning the hands-on portion, and now being here I'm learning how to do hand ties, how to do the different birth maneuvers, and just gaining that confidence to transition into that role of now actually being a student midwife versus just a didactic student midwife.
But when you come together, you see people in the room that look very differently from you or from different geographical areas, and they have the same goals as you. So it's kind of surreal, but it's really cool to see that live experience, and you exchange information and experiences, and you learn from each other with each interaction of being together on the campus.
To fulfill their clinical requirement, students provide nurse midwifery or nurse practitioner services in their home communities under the guidance of a preceptor and with the support of Frontier's regional clinical faculty. After completing all program requirements and clinical hours, many students choose to return to Kentucky for graduation.
That you come here for a few days, a few times during the program, and it gets into your heart in a different way. And we call it homecoming when we all come back. It's a really special place. I think it is the Frontier experience, and the program couldn't be the same without it.